mouth still remember the taste of my love? Will your eyes still smile from your cheeks? Darling, I will be loving you till we're 70. And baby, my could still fall as hard at 23. And I'm thinking about how people fall in love in mysterious ways. Maybe just the touch of a hand. Well, me, I fall in love with you every single day. And I just wanna tell you I am. So honey, now
Come on.
take me into your loving arms. Kiss me under the light of 1,000 stars. Place your head on my beating heart. Thinking out loud, maybe we found love where we are. When my head's all but gone and my memory fades, and the crowds don't remember my name.
Good evening. Welcome to Oche Kitchen again.
When my hands don't play the strings the same way, I know you will still love me the same. 'Cause honey, your soul could never grow old and evergreen. Baby, your smile's forever in my mind and memory.
Wow, Uncle Theo came in today. Uncle Theo is probably having arthritis. Chinyelu, I think you need to write a prescription. Somebody came in today.
I'll just keep on making the same mistakes, hoping that you'll understand. Baby, now take me into your loving arms.
You're welcome. I think you need prescription. Give us that today. All right, Informer, 1 minute.
Place your head on my beating heart. Maybe we
need the prescription.
right where we are. Baby, now take me into your loving arms. Kiss me under the light of 1,000 stars. Oh, darling, place your head on my beating heart. I'm thinking out loud that maybe we found love right where we are.
You don't want it to go off. Where did Kobe go? I'm ready for her. Like every day, just like falls off from him another one. Yes.
Good evening, everyone. Can you hear me?
Yes, we can, yeah.
Okay. You're welcome to tonight's edition of Oche Kitchen. And I'd like to introduce my co-host. First of all, we have Ijen Doku. We have Ifi Moma. Winifred is running late, so when she gets here, we'll introduce her. And my humble self, OJ. And we have the gorgeous Dr. Chinyelu in our midst. Tonight
Hey,
we're
how
gonna
Our prescription writer. All right, welcome everybody. All right, everybody, welcome to Oche Kitchen. Before we start, I have a joke about middle age. They say middle age is that time in your life when you finally get your head together and then your body starts to fall apart. Which is true because I know when I hit 40, I start wearing glasses, other things, the hip pain, the aboniki balm beside my bed. So having said that, I'm going to we're going to start the questions with Oje. Take it away.
Okay. I still can't get over the aboniki balm.
I'm telling you, I have it bedside all the time.
Okay, the first question for tonight is, Doc, can you tell us the age appropriate checkups, such as the colonoscopy, the mammogram, the pap smear, and stuff like that?
So pretty much, I'll just introduce myself. My name is Chinyelu Oraedu. I'm a board certified internal medicine. I take care of adults, 18 to the end of life. So when you talk about age appropriate, you have to understand that we're talking more about people of average risk. It means that if you have other confounding problems like for colonoscopy, it's recommended that
yourself? I'm trying to mute.
You should start screening from 50 years. Once you get up to 50, you should start getting a colonoscopy. If it's normal, then you should do it every 10 years because that's about the time it takes for if there's an abnormality, which usually is a polyp, an abnormal growth in your colon. Studies have shown that it takes like 10 years before that growth can grow to become cancer. So if a normal one at 50 years, you don't need to check until 10 years time, which is 60. And this is people that are average risk. These are like, normal healthy people. But when you talk about other people, if you have a family member who's had colon cancer, first degree family member, your father, your mother, your brother, your sibling or first degree on, then you have to start earlier. We normally start 10 years before the age of the youngest person who had it. So, and then when you move on to screening for pap smear, which is, the screening test we do for cervical cancer, routinely in most Western countries, they believe that, the studies show that, most children have their first sexual experience, between the age of 12 and 25. So as a result of that, they recommend to start screening for, the pap smear. They started at about, 21 years of age. They start screening them. If it's abnormal, then they have to do it more frequently. And frequently means maybe probably every 3 to 5 years, most times. And then the question is always, when do you stop screening? As long as you're sexually active, you have, actually people who have multiple sexual partners, they usually screen till way into 65 and even 70 years. Because the thinking is in Western countries is that they look at life expectancy. If you're expected that you're going to live 10 years beyond, the last, assuming you're 65 and you have you don't smoke, you don't drink, your body is in good shape, they can continue screening you beyond even 75 years, as long as you're still sexually active. But a recommendation for pap smear goes as high as 75 years, actually. And something else we screen for again, besides, I've mentioned colonoscopy, pap smear, is breast cancer. Routinely, and people should, get checked out for breast cancer. And the recommendation is kind of a little bit fuzzy. Some people recommend 45, some people put it at 50. But I think the most important thing is the risk factors that you have.
Chinyelu, are you talking about mammogram, or are you talking about what? Because you said 45 to 50.
I'm talking about mammogram. Mammogram routinely, because the recommendation, you have to know that different societies, have like here in America, you can have the American Cancer Society, then you can have the Society for OBGYN, the OBGYN. So the consensus most times is at least, by the time you get to 45 years, you should have had a mammogram.
Gotcha.
But most physicians will start at 40. Most physicians will start at least having that discussion with you at 40 years that you need to have a mammogram. And the reason why they kind of try to, wait to your is that, the female, young breast is very dense. When they do mammogram, they tend to pick up small lumps that may not really be cancer, but because they've picked it up, they have to do biopsy. They have to put you through more tests. So if you don't have a strong family history, they may postpone it to like 45, but you find out that, in real life, in real setting, at the age of 40, your doctor is going to start talking about that you should need to go get a mammogram. Yeah. And of course, if it's normal, recommendation is that you should check it every 3 years. But you find out that, given the, prevalence, they tend to push for you to do it more frequently. But I must say that people who have a family history of breast cancer, family history, I mean, your mother, your sister, very close relative, they start doing it much earlier. They can even start at 30 years to start screening you. And in that case, they can do like a breast MRI, which has more, sensitivity, especially, in the young breast. So, when it comes to, screening men, the cancer screening they do for men, prostate cancer is pretty, common. It's a male prominent, cancer. But the thing about prostate cancer is that even here in the United States, they found out that the US tends to, because the main test they use for men is the PSA, they call it PSA. It's a blood test. So if it's high, then they're going to screen, do more testing, they have to get a biopsy and all that. But here, they tend to look out for men who are very high risk, black men, very high risk of prostate cancer. If your father had prostate cancer at a young age, young age is less than 65 years, you have a very, higher risk of that. So in that case, they recommend that from the age of at least 50 years, when a man gets to 50, he should start having that conversation with his doctor about being screened for prostate cancer, which includes the PSA, which is about the best test that we have now. If your father had cancer, you may have to start at 40. It's always remember that if you have in cancer screening generally, if you have a family member who had that, history of cancer at a young age, you're likely going to be screened at 10 years younger than the age of that person. So if the person had it at 35, at 25 years, they're going, especially in the United States and most other Western countries, they're going to start testing you for all those things 10 years younger, so that they can pick it up and intervene. Yeah. So pretty much these are like the screening that we routinely do. And maybe I can put it here too about and I know some people have heard about the Vadacil,
yes.
HPV vaccine. Ideally, children are supposed to get it at 12, starting from 12 years. Boys and girls too. Boys and girls, because the reason why boys get it is that where if boys are not vaccinated, then they can get it from the girls too. Yes. So it's like a situation of like, when you hear of like herd immunity, you vaccinate everybody so that when they grow up, because children are going to, mess, they will have sex. Let's just call it by what it is, And so and pretty much the vaccine, because there are like 3 different types of vaccine. You know, they do vaccinate against the most virulent ones, which is the one that causes cervical cancer. That is the one, because cervical cancer, it's about the 4th, you know, I think the 4th commonest cancer in women thereabout. And in most Western countries, it's, you know, it's very, very preventable. You know, it's very, you know, even when I went to medical school in Nigeria, you know, it was really sad to like see that, you know, the awareness is not as heightened as you will expect. So the whole idea is, if we vaccinate people, then at least we minimize, you know, the risk of cervical cancer in women. And when you talk about men, you know, oropharyngeal, even cancer of the tongue, of the you know, head and neck. And then, of course, we have to talk about gay people. You know, they have risk of, you know, anal cancer, you know, and cancer of the penis, and you know, so it's something to think
For
about.
real?
And if you can get your children vaccinated. Huh?
No, you said gay people have a lot of
What did you say?
anal and oral cancer.
Gay people have, yeah, I mean, it's pretty much prevalent in their community, you know, and you can relate to why that could be the case. So there's a strong movement to start getting children.
Okay. So that, thank you, Doc. That takes us to our second question.
I think she's frozen, Oche.
Oh, for real?
Yeah, she was frozen. Okay, she's back. Yeah.
I wonder if I can see everybody.
Are you on your laptop or on computer?
Go ahead.
Use, if you want to see everybody, use the gallery view.
Hello.
Okay. Hello. Yeah.
Yeah, please. I want to ask the doctor, what is the cause of all these cancers? I mean, what is the main cause? You know, so that I mean, taking care of themselves.
Okay. You know, when you say the cause of cancer, you know, we know that, you know, cancer is just you know, when your cells start to, you know, I mean, for lack of a better word, you know, for whatever reason, there's a mutation, you know, the cells just kind of don't respond to the normal physiology, because, you know, in our body, you know, nature has made it in such a way that, you know, every cell in the body has a lifespan, you know. You know, the cells stay for some time, you know, then there's another process that takes it away and replaces it with another new cell. But for whatever reason, you know, there's a mutation, there's some abnormality that gets, you know, introduced at the cellular level in your body, and your body just starts to, you know, multiply, and it doesn't respond to the normal mechanism that the body uses to clean out itself. So it becomes abnormal, and it takes over the process of the body. And that's when you now start to, you know, and it behaves abnormally, which is why sometimes, you know, when you start to treat cancer, you know, the older drugs we use to treat cancer, you know, in destroying the cancer, you destroy both the cancer and the normal cell.
Yes.
That is why, you know, so that is the thing. I mean, it's, you know, it just takes over the whole mechanism of your body, and it just grows and grows, and you start to become sick. So, you know, the much we know about, you know, prevention now is, I mean, first of all, there's a strong genetic component to cancer. You know, some of them, you know, we have genetic, you know, in breast cancer, you know, we have the, you know, if you have to go into the genetics of it, you know, the BRCA, you know, people that have the mutation, it runs in families. You know, the mother had breast cancer, maybe the sister had ovarian cancer, then one brother had prostate cancer. So there's a genetic component to it. And then we also know that some lifestyle, you know, options, you know, some lifestyle that we you know, live, you know, and that does predispose to that, like smoking. You know, we have known that smokers have a higher incidence of having cancer. You know, alcohol, obesity, you know, So these are some of the, and then race, unfortunately it has been thrown into it that, Black people are more predisposed to,
Black
like
people are
prostate
at
cancer,
risk for everything.
I know it's so unfortunate. Everything starts.
It is.
They're gonna mention Black people. Okay.
Black
Then
people.
they start
Corona,
breaking
Black
it
people.
Anyway, yeah. So
Okay.
that is just a small preamble. Yeah.
Okay.
All right, thank you.
So that takes us to the second question. How does sleep and exercise affect our health?
How can we say sleep is? First of all, sleep is mechanism whereby the body recharges. When that is why you're supposed to sleep. The body will recharge and you wake up refreshed. So, recommendation is that you should sleep at least 7 hours. You should sleep more than 7 hours. That's what adults need. Adults should sleep 7 hours or more. And because when you sleep, your immune system, reboots itself. Your mental sharpness, your cognition, you reduces irritability, anxiety, depression. But we know that the mechanism of sleep, for people who do shift work, it messes up your sleep. So the link between sleep and exercise is just that. Well, first of all, if you're unable to sleep well, weight is going to be a problem because your circadian rhythm is out of, which is the rhythm that, puts your body into when to sleep, when to wake up, and also your hormones, because the body is so well made that it runs on hormones, your cortisol. So when sleep is not optimal, your cortisol is, well elevated, you start to gain weight. And then exercise becomes, because it's recommended that you should exercise 3 times a week, at least 35 minutes moderate activity 3 times a week. That is a recommendation. So you find that if you cannot sleep, you don't have energy, you cannot exercise, you start to gain weight. And of course, when we talk about gaining weight, the problem with gaining weight is that, especially in females, we tend to gain weight in areas that cause a lot of problem. By that I mean,
abdomen.
belly and abdominal fat, and that is a risk for cardiovascular disease too, because your abdominal girth around the neck. So it impacts sleep and exercise work hand in hand, and you find that people who are unable to sleep or don't get enough sleep have tendency to gain weight. And with the weight gain, exercise is far-fetched. So if you don't exercise, it becomes like a vicious cycle. So that is a correlation between all of them. But technically, you should try to exercise 3 times a week, 35 minutes, moderate to high intensity. Yeah, and then of course your BMI. We all know BMI. We should keep it between at least 14.5 to like 24.5. That is the ideal. Anything above that, you're overweight, you're underweight, you have problems.
You're obese too.
Doctor, can I say something to that? Add something to it. You know me too well, and my mom translated it that I go to bed the same day I wake up.
But it's true. It's true.
Meaning that I don't sleep.
It's true.
I've never escorted anyone to a gym house before. So that means that I've never climbed any treadmill. I don't do exercises.
Yeah.
So on the contrary, all those effects of not sleeping and not exercising is not showing on me. What could be the reason behind that?
Yeah, the thing about sleep is that, some people can function on very limited sleep. I can tell you, I am one of those people. I can tell you to sleep 8 hours. I don't sleep 8 hours. I just cannot sleep 8 hours because I have tons of things to do, but the thing about, the way you sleep, some of it is hereditary too,
Yes.
it's the way people sleep. Some, you inherit it from, your parents, the whole sleep mechanics. But for whatever reason, everybody's metabolism is different. That's why 2 people will eat the same thing. Some people will, tend to gain more weight than other people. And some people will not sleep and they're very foggy, they're very irritable, they cannot function. And the other person is running on 2 hours of sleep and somebody who sleeps the whole night. So it's, if the physiology of it is well understood, I mean, I will have the best answer for you. But the much I can just say is that everybody's body works on metabolism is different.
It's true.
And what we talk about is average. We just, on the average, the medical,
because Chinyelu, Dr. Chinyelu, growing up, if we see you fat and plump, we tell you because you sleep too much. That's why.
Or eat too much. Also eating too. Yeah, it's true. Sleeping. Yeah,
you sleep too much. That's why you put on so much weight. Anyway, thank you very much. Thank you.
All right, Chinyelu, talking about the circadian cycle, it's very, very true because I have a friend who worked nights for years. So she started day, and she's been trying to lose weight all this while. She started day job 9 to 5, I think late last year, and she's been losing weight, not doing much. But then she used to watch her diet, do this, but she never. So sleeping because she working nights. So what do you tell like the healthcare workers, or not only healthcare workers, people who work nights? How can they balance their sleep life circadian cycle? How can they do that?
Okay, when you talk about people who work nights, I do a lot of nights.
I know that.
I'll put it out there. Now, I do a lot of nights as part of what I do. But the thing about it is that, like I said, sleep hygiene, the way you sleep is, besides that, you teach yourself how to sleep. They tell you that when you go for, in insomnia, people that have difficulty sleeping, they tell you that you have to go to bed the same time every day, every night. And then, first of all, you have to limit, even if it's that phone call that is going to irritate you, or that person that will put you in a very whatever and get you so hyped up, you avoid things that irritate you. Around that time, you go to bed. And then if you can exercise, it also helps, with to calm you down. But people who work nights do have a higher risk of a lot of sleep issues. That you just have to. You just have to find, the correct time to sleep and things, activities to do. Like recently, I like to exercise before I sleep.
All right. So, Mama, do I have time for a question before you go to commercial? Should I go ahead? All right, Dr. Chinyelu, the next question is, why does our risk for heart disease and diabetes increase with age? Why?
Yeah. My dear, why don't you just put it out there that, age, so many nice things happen when we get older, children get, hopefully you don't have the, as kind of, you feel like that you're beginning to get yourself back, you're getting your mojo back, that kind of thing. But on the other side, you have to understand that the effect of some of these hormones are now fading away. If you're getting perimenopausal, you start getting into the 40s, you start to the protective effect of estrogens and all those hormones are starting to ease off. You find that things start to leak. What is it? You're not incontinent. You can't. Things start to get saggy. But overall, the problem is that the thing is that diabetes. As people get older, a lot of people will first of all, gain weight, and with the weight gain, the risk of diabetes becomes much higher. And you have to understand that also a lot of women, will have children around their, 20s, 30s. Gestational diabetes remains untreated. So when they're not getting to their 40s, that will be the first time they're hearing that they do have, type 2 diabetes. And of course, you cannot under to emphasize, people who drink alcohol, smoking, number 2. And then, of course, that's when your family history starts to kick in. People that have cholesterol problems, cholesterol that was never enough. You have to check your cholesterol at least one time in your 20s. At least one time, get it checked in your 20s. And then when you get to your 30s, annual exam, you should get it checked too. So, and thyroid, the thyroid hormone, as people don't really, I guess in Western countries, they do check thyroid as part of, around pregnancy, whatever, testing. But you should be checking your thyroid because the thyroid is a hormone that is essential for life.
It's the engine block of the body.
You cannot live without your thyroid. And then the thyroid controls, your cholesterol too, metabolism. So these are things that if you have low thyroid problem, you're likely going to have cholesterol problems. And of course, with cholesterol issues, you're going to have cardiovascular disease, because you're going to, the arteries are going to get clogged up, and then it becomes a risk factor for heart attack, for strokes, and other health conditions. And then smoking, every time the doctor has to emphasize that you need to stop smoking. For those that smoke, you need to stop smoking. Yeah. So so that is the link between getting older, hypertension, diabetes, and cholesterol. It's just that, the risk of obesity is higher, being overweight, BMI, and then people that have gestational diabetes that wasn't really followed up after the pregnancy. Some people have hypertension or preeclampsia, or during pregnancy, they don't follow up.
Yes.
And then they just think that they are fine. They don't know their blood pressure has never resolved. They don't take medicine. And sometimes the first sign you're going to have is a mini stroke. All of a sudden you're in the marketplace, then your arm starts to go to sleep. You're, oh my God, what's happening? I can't use my arm. And then it happens and it goes away and you don't pay attention to it. And then the next time, within a short time, then you're going to get a real stroke. So, when you get older like that, you have to be on top of, blood pressure, diabetes, cholesterol, thyroid. You have to be careful about if you're sexually active, multiple sexual partners, STI, sexually transmitted infection, because of cervical cancer, and stuff like that. Anal cancer, depending on how what kind of sexual preference or practices you like to perform. So these are things that 40 and above you have to, and then exercise. Every time you have to train it as much as you can, to exercise 3 times a week, 35 minutes. That will try to at least keep you in shape. Yeah, to some extent. Right. Yeah.
So you said most times when people don't know that they had GD or hypertension, and then it's a mini stroke. Don't are there signs of blood pressure that people should be aware of in case they're having it and they think it's just regular headache or something? There are things you can say,
for the most, hypertension is called the silent killer.
Yes.
That is what hypertension is called. It's called the silent killer because some people will never know their blood pressure is, I guess some people will tell you over time, I know my blood pressure is high. I start to hear ringing in my ears, I start to have throbbing in my head. But for the most, it's silent, and unfortunately, sometimes the first time you will know you have high blood pressure is when you get a stroke, unfortunately. So pretty much they advise people that, the good thing about, I keep referencing Western countries because that is what I, where I work and what I have for now. But I trained in Nigeria and I know the practice in Nigeria too, is that when you get to at least, like here they say at 21, 25, you should check your cholesterol. When you get into your 20s, childbearing age, you need to at least monitor your blood pressure. You need to monitor it. I mean, a recommendation now is to keep your blood pressure less than 120. They're very tight about blood pressure control now, the current recommendation. The systolic one, they want it less than, at least about 120, less than 130 at least, and the lower one less than 80. That is normal blood pressure. Yeah. That is what they're shooting for now. Because they found out that high blood pressure causes kidney problems. It causes eye problems. It causes heart attacks, strokes. So in people in their 40s, that around, post childbearing age, around childbearing age, you have to check your blood pressure. Even after you have a baby, you have preeclampsia, you need to continue checking your blood pressure. For some people, preeclampsia happens and it resolves after the baby is born. For some people, it doesn't resolve. They become hypertensive, the rest of their life. And the thing is that you always hear people say that, my blood pressure is okay now. I don't need to take medicine. Your blood pressure is okay because you're taking medicine. Maybe it's okay because you lost weight. Maybe it's okay because you stopped smoking. But if you need to take medication, just take medication. Take it as when you need it. And then over time, if your doctor feels it's safe for you to stop it, then you can, under the guidance of a medical professional, get off medication. But for the most, and the same thing with gestational diabetes, diabetes that happens around when you're pregnant. Most people that have gestational have very high risk of being diabetic. And it's unfortunate some people never really hear it again till in their 60s, and they hear they're diabetic. But it's been lingering since the baby in the 30s, the 40s, you didn't pay attention to it. And the first time you see the person has a diabetic foot ulcer, or the person has, blindness, or the person has kidney problem, and then that's or even for hypertension, the same thing too. And then it becomes a bigger problem now because it's affecting the person's life,
Yeah.
So yeah. So that's the.
Before I ask you the next question, Ifeoma, before you go into commercial, I need to. We had on our Oche Kitchen Thursday's Health, we had a doctor from England do an episode for us, a short clip about blood pressure. And he said that, I think he said 40 years. In England, once you're 40 years old, you're advised to start taking blood pressure pills. I think it's either 40 or 50, he said, but I think it's 40, he said. And I don't remember us practicing it here in the US. Is it like, do you guys encourage people to start taking blood pressure pills? Or did he mean the aspirin regimen? Because I know once you're of a certain age, you're encouraged to take aspirin.
It's the aspirin that he was talking about.
It was aspirin he was talking about?
Yeah.
Because he called blood pressure medication.
Even aspirin is very controversial here in the United States. You know, taking aspirin for primary prevention, that's what they call it, you know. Because it's important to know why people take aspirin. Are you taking aspirin because you've had a stroke or a mini stroke or you've had a heart attack? Or are you just taking aspirin, you want to prevent yourself from having any of this, you know, strokes or like heart attack and all that? You know, in that case, if you've never had any event, you're taking it for prevention. There are so many doctors that they don't advise it because of the risk of bleeding. You know, and the risk so it's you know, it's been the research has been neither here nor there, so they leave it to the patients to choose if they want to take it or not. Especially in people that have not had heart attacks or strokes, the research is not really, you know, we don't really put it out there for everybody. Oh, take a baby aspirin, take it, like we used to say before, because you know people started having, you know, bleeding episodes as a result of you know, taking aspirin without any clear indication. Yeah, but I know in England, probably the practice is different. America is a little bit more conservative with some of their recommendations. Yeah.
All right. Thank you. Mama, should I ask the next question or are you ready for
let's
commercial?
take a minute break, Ijoma. Let's take a break before your next question, yeah? Thank you very
Go
much.
ahead.
Oh, wow.
Welcome to 280 Degrees African Restaurant.
Oh, sorry.
Only God knows when I did this kind of journey last.
Welcome to 280 Degrees African Restaurant and Bar. Our well-trained and polite staff are at the ready to serve your favorite alcoholic beverages and cocktails. Music is supplied by the finest DJs in London, and security is tight but polite. Our opening times are Sundays to Thursdays, 1 p.m. to 11:30 p.m. Fridays and Saturdays, 1 p.m. to 3 a.m. We are centrally located at number 280 Kilburn High Street, London, NW6 2BY. For phone bookings and takeaway orders, please call 0207 328 8832. 280 Degrees, where the noble class hang out.
All right, thank you everyone for joining us back again. Okay, Dr. Chinyelu, my next question is, what should the men know about the prostate cancer? Because I see Theodore came in today and we haven't seen him for like a long time. So I know he wants to know about his prostate.
Yeah.
So what should the men know about their prostate health?
They should have that conversation with their doctor. At least when they get to 40 years old, and about that 40th birthday, heading to 45th, you should bring up the conversation about prostate cancer with your doctor. What it means is that, you know, they'll do like a digital rectal exam which is an unpleasant exam.
Inserting the finger, right up their anus.
Go to the second, your butthole to feel for your prostate. And after that, they'll do some blood tests. They'll send we call it the PSA, prostate specific antigen. So they send it out, and if there's an abnormality, greater than 4, they have to send it to a urologist, which is a doctor who handles the male private area, to do more testing. But like I said, they said prostate cancer is commoner in Black men. So it's something every Black man should be aware of. And secondly, it's very important you know your family history. You need to know whether your father had prostate cancer, your uncle had prostate. If they had prostate cancer, especially prostate cancer at a young age, less than 65, then you need to be more concerned. You need to get screened much earlier. So you should start at least at 40 years old to screen for that. So that is for prostate cancer. I'll put it out there that the guidelines is a little bit, because in America they feel that they over test and they over screen, and because of that they over treat. Because you need to know that prostate cancer is believed to be a very slowly growing cancer. That if you live to be like 80 years old, that if you go and take autopsy of all the old men, 80, 90, who died at 80 from something else, that there's cancer in their prostate.
Wow.
So if you live to be very old, that you will have prostate cancer. But the people they worry about are people that have it when they're young. So that's why they screen people that have strong family history. Yeah, so that's pretty much what you need to know. But you have to minimize smoking. Every time you talk about cancer, you have to put it in that people that smoke have high risk. People that have, if you've had radiation before, for whatever reason, radiation to the pelvic area. Because radiation itself, even if you've had breast cancer and you have radiation to the chest, it puts you at risk of having another kind of cancer in years to come. So in men, that is pretty much what they just surveillance and starting on time to start doing that digital exam and getting the blood test. That is for now, that is all they have for prostate cancer.
All right. Ifeoma, before you go on, I have a question for Dr. Chinyelu. Doctor, does depression come with age? Or I know a lot of young people are depressed, but it seems like a lot of older adults, get depressed about things. So does it really come with age? Hello?
She's frozen now.
Oh, she's frozen? Oh, I don't even see. Oh, she's frozen. All right.
Okay.
Oh, I
lost her.
Yeah, sure.
Please, after the doctor, I would like to say something. Advice.
Go ahead, Uncle, now. Go ahead and say what you want to say.
All right. Okay.
Yeah, go ahead. The doctor is right off now.
Chinyelu,
are you back?
Want to thank the doctor. For what he has given to us. Yeah. But another thing is that I personally, I am into alternative medicine, and I advise people. See, please, what I want you all to know and to take note is that our body is able to cure itself. God made our body to be able to cure itself if you give the body the right nutrients, the right things the body needs to help itself, the immune system, the hormone system, and things like that, you see. And you can see that the doctor, in her knowledge, she, maybe because nobody has asked of the remedies, you see. But the most important thing is for one to give the body the right nutrients in terms of what you eat. Now you find that this cancer thing started really when we Africans, started eating the so-called food,
Mm.
you know,
Okay.
All right.
processed
All right.
foods and things in that area, you know. But if we can go back to the natural food, avoid processed foods, you know, and so on, then the body will be able to prevent all these things happening to us.
Okay.
All right.
That
All right.
is so
Thank you,
true.
Daddy.
Yes.
I think the doctor is back. Chinyelu, are you
All right,
back?
good.
Yeah, I'm back.
right.
Yes. Yeah, I heard his comments. Yes, absolutely. You know, the whole issue of processed food and you know, all the, you know, changes that happen in the body as a result of that. Absolutely. Absolutely. There's truth to it that you know, the all the additives that have, and all the transformation that food has, you know, gone through in the past, you know, couple of years may have increased you know, actually the hormonal additives in foods may have some
Impact.
contribution to the, you know, the prevalence of a lot of cancers now. Yeah, and that conversation is still out there. You know, I mean, I won't comment on that because you know, I don't really have the numbers now, but we always advise people to avoid processed food. You know, it's something that it's something that, you know, is well known in the medical community. You know, when you say eat healthy, we mean eat like, you know, fresh vegetables, fruits, whole grains. You know, not enriched, you know, enriched food with additives. You know, stick to the whole grains. You know, and the nuts. So yeah, Daddy has there's some validity to what he's saying, but I just cannot. It's known, but the research is not totally
Not
concluded.
founded.
So, yeah.
Okay. Doctor, I want to ask you, can you summarize menopause to us for ladies and what to expect?
Oh,
Are you scared?
Oh, Rundilao. Hey,
and from what age does menopause start?
I mean, you know, when you say
See
menopause,
us, all of us are out.
remembers that menopause when, you know, the period starts, you know, but it's actually a whole period. You know, it's a whole span of time from perimenopausal, you know, way before, you know, in the early 40s, when you start to have all those, you know, hormonal irregular periods. You know, you have a period this month, it doesn't come till the next month. You know, your sleep is out of, you know, you don't sleep well. You know, you find that your sleep is so fragmented. You know, you find out that your mood is swinging. You know, this minute you're happy, this minute you're like very pissed. You know, very, you know, it's very moody. And then the vasomotor symptoms, you know, that's the hot flashes everybody knows about. You know, this minute you're hot, the next minute you're cold. So these are the symptoms that herald the beginning of that period. And of course, you know, heading into the 50s, you know, when one day, you know, you now go into full-blown menopause. And of course, you know, if you go to your doctor's office, they can have that conversation with your primary care doctor, your OBGYN, that you're having all the symptoms. You know, some doctors will, you know, do a blood test to check some of your hormones, you know, LH, FSH, some of the hormones. But also, you know, on a physical exam, you know, some doctors can actually, your OBGYN doctor can, you know, look at your, you know, your female parts, especially the changes in the vagina, because we know that, you know, unfortunately with menopause, the vagina gets, you know, the changes around the lining, it gets dry. So there are some physical
and that's when you
that
need
you
the
may be going through
lube.
that process. Yeah, you need to get a very
I was dry. I had to drink something.
How can you be talking about menopause about time? You haven't even come close to it, you know? You haven't even come close to it. So you have to, you know, so the conversation it's an ongoing, I mean, there's some medication, and the mood swings is really real. You know, the mood swing, this minute you're happy, the next minute you're just so pissed, the phone call, anything makes you so mad, So, I mean, they talked about, some hormone replacement, estrogen, progesterone, they talked about, some medications that help with the mood part of it, some Volta. They actually say use some antidepressants to manage the
Dr. Chinyelu, like you mentioned that before you got cut off, Ijoma was asking, is there any correlation, any connection with depression and older people, 40 plus? Could this mood swing during menopause be mistaken for depression in adults?
It's really possible that older people, the mood swing, because when you talk about menopause, it's a very long period. Almost a perimenopause, almost like a 10-year span before you actually get into the real deal. As in one day you wake up, the period is gone. And then your body now starts to, your doctor tells you, looks at your vagina, and you have changes that are consistent with the vagina and the vulva.
Physical changes.
So yes.
And my mom never told me. Okay.
Oh yeah. This girl. You know, Mama, she's here. Be careful. Don't lie on that lady.
Mommy didn't tell me that menopause has physical changes.
The place goes through some changes, but the thing about it is that the mood swing, a lot of people don't really recognize that, or maybe they are aware of it, that, it makes you very, your hormones are out of whack. Your hormones are totally, and I think one of the frustrating thing is the hot flushes, the hot flushes that a lot of people experience, it's, because people around you may not really know it, you crank up the AC, you turn it off, you turn on the heat, you turn it off, it just drives you crazy. And then you can't sleep. So I think the impaired sleep or the fragmented sleep, which we all know that lack of sleep contributes a lot to depression. It's one of the most frustrating things a lot of people will complain about. So it's likely, you may not really call it depression, because depression is a very, it's a diagnosis on its own. It might be a mild form from seasonal kind of, dysthymia. There's so many other, small, description of mood issues before you can really call it depression. But and maybe you don't need medication for it. Maybe you just need to change your, some kind of psychotherapy. Because sometimes when you change the way you think about something or approach a problem, your reaction to it changes. You start to exercise more. So that, the more you exercise, the more energy you have, you have the endorphins, it improves your sex life, and maybe you start to sleep better. You don't need to go on medication. So there are actually ways that perimenopausal women can approach their life without having to, using medication as the last resort. And you also have to know that, the older you get into the whole menopause situation, people have a lot of problem with urinary incontinence. You can't hold it. You have to do it.
You be like, let me come. Oh, hi.
When you have to go, you have to go.
wants to ask a question. Doctor, somebody wants to ask a question. Go on, Aderama.
Okay, hi everyone. It's not really a question. I just want to point out that some people go on early menopause as early as 20 years due to medication. For example, I myself have gone into menopause due to medication, and it's hormonal medication that I'm taking. So it's actually kicked off early menopause, It depends, again, it depends, different people, is it C? I wouldn't say C, no. Their menopausal states are in different stages. Like the lady was talking, yeah, sometimes you're feeling cold, 1 minute you're hot. If you live in the country where I stay in the United Kingdom, and sometimes when it's extremely hot.
Like yesterday.
Some days I'm hot. And when it's extremely hot, I am feeling cold. So people are wondering, why are you wearing jumper when the weather is too hot? you know. So it fluctuates, and different people feel it different ways. So it's not necessarily when you've reached the age of menopause. Medication can be a trigger to early menopause.
Okay.
Absolutely. You're very right. You know, once I mean, any condition that causes ovarian failure, you know, because you know, in women, the ovaries are the reservoir is the organ that produces the hormone. So any situation whereby the ovaries don't work, whether it's because it was removed by surgery or you took chemotherapy or radiation, and your ovaries don't work, you will go into menopause. Unfortunately, you will start having those symptoms, and then they will have to augment it with what other medication that, and different people tolerate it in different ways. You know, some. So I would say that most Western people have it. You know, they have a lot of problem with menopausal symptoms. You know, they do take a lot of medications to alleviate that. Yeah.
Okay. Can I ask my next question now?
Can I ask something? Can I ask a question about menopause?
Okay, go on.
Go ahead.
Yeah.
Okay. Hi, Dr. Chinyelu. Thank you. So I have a question. You talked about anything that has to do with ovarian failure. So will IUD kick in or make menopause, to come fast? Can you highlight on that? Okay.
No.
IUD is
a totally different mechanism. You know, IUD is pretty much, you put it in there for whatever reason. It just, some of them have hormones. It triggers. It's just a device that prevents pregnancy by altering the hormonal balance in the female body. But it doesn't trigger menopause. When you take it out, your body normalizes. So you will still go back to your normal cycle of if you're still within the age limit for reproductive age. So IUD is not it has nothing to do with the ovarian failure. It's a birth control method. It's a device for birth control. But when we talk about ovarian failure, is menopause is ovarian failure. That's what it is. The ovaries have lived their life and they've retired. Go into menopause. Unfortunately, it's a circle of life. But if for any reason, you have, a reason to remove it, either you remove it for cancer prematurely, we have premature ovarian failure. That's what we call it. You have to remove it for cancer, or you were, radiated for surgery or radiated for cancer, or you took chemotherapy and your ovaries failed, and then you now start to have menopausal symptoms. That is what we talk about, premature ovarian failure. But menopause is the natural process. You're supposed to continue to be reproductive, till menopause. But unfortunately, menopause is they call it the perimenopausal period, which is like, in the early 40s leading into menopause, most likely in the 50s. And some menopause, sometimes, it follows a trend. Most people are if your mother had early menopause, it may be a trend that you may have to be concerned that might be your
Kakaraka.
Yeah, that might be the natural cause of your own sexual situation. Yeah. So that's what it is. Yeah, fortunately.
Okay. All right. And my next question is, can you explain osteoporosis and how it affects us with age?
So when we say osteoporosis pretty much means, weak bones, and the thing about, weak bones is that it's something that affects mostly older people, postmenopausal women. That is another problem with menopause. When you start to get into menopause, the way the body was made, we're going to talk about men and women, because most times when they say osteoporosis, everybody worries about women. Men have osteoporosis too. Especially the men who have osteoporosis, it's common in people that have low testosterone. For whatever reason, if your testosterone level is high, because it's low, you're going to put you at risk for osteoporosis. Because testosterone is important in the building blocks for bone. for the calcium, the matrix that builds them. Because bone is about the hardest whatever in the body. The bone is very hard. That is why it's way deep and it's surrounded by muscle. And so men who have low testosterone are prone to osteoporosis. People who take steroids, people that have asthma, immunocompromised people, people have kidney transplant, liver transplant, whatever transplant you have, and you take prednisone, asthma. Because some people have bad asthma, they take prednisone all the time. It puts you at risk for osteoporosis because steroids weaken your bones, right? Especially when you take it out exogenous steroids. And they find that in people that osteoporosis in women is mostly more than 60 people that are more than 65 years old, and we normally find it when people fall. Because the bone is so strong, right? When you fall out from your bed, as mean that your bed is like maybe 2 feet high or not too whatever, and you roll off your bed, you shouldn't break your bones. So when people come to the hospital and they rolled off their bed, an old woman and her bones are cracked, you worry, is she osteoporotic? So there's a special X-ray that they do to pick up osteoporosis. They call it a DEXA scan, DEXA, DEXA scan. So they do it in people that are 65 and above. It's a screening, it's a recommended screening exercise in older women. And they also do it in men who have the risk. Like I said, men who have low testosterone, men who take steroids, they also screen them for osteoporosis. It's less common in men because testosterone is an anabolic, it helps to build bone. So osteoporosis is not as common in men as it is in women. And because women go through menopause, estrogen, which is the female hormone, helps to build bone. So when estrogen is gone in menopause, women have tendency to have weak bones. So to prevent it, people need to exercise. You tell older women you need to exercise, and not just exercise as in walking. You need to do some exercise that helps you to build bone. Like, you can tell people, a little bit of weights to help you to strengthen your bones. You have to stop smoking. Smoking is very bad for osteoporosis. And also at the same time, I think the best thing about being overweight is osteoporosis. Obesity is actually protective for osteoporosis. That's the only place obesity comes in, a little bit helpful. It's a protective, diagnosis. It helps you prevent osteoporosis. That's why you see it is commoner in thinner people that are thin, people that are, it's commoner in, Caucasian and people of Asian descent, but we encourage people to drink milk, because milk has calcium, milk has calcium.
Yeah.
So yogurt, cheese, even in Nigeria, green vegetable, like all this ugu, spinach, it has a lot of calcium. Nuts have, and almonds have calcium too. So milk, and then of course, vitamin D. Everybody should be on, once you get to 40 and above, you should be taking vitamin D supplements.
Vitamin D,
you should take at least 2,000 units a day.
Yep.
It's good. And and then of course, if you have osteoporosis, then you have to go for treatment. They have medications, and they have guidelines for which medications to give, whether to give you IV, give you bisphosphonates. So this is like a whole different, bigger topic. But in summary, osteoporosis should be screened for in anybody over 65 who is in menopause. Postmenopausal, over 65, should be screened for osteoporosis.
Chinyelu, can I cut you off for a minute? Somebody just asked that many people don't understand what osteoporosis is. Can you take a minute to, like I said, brittle bones, but can you explain what it means, like from your own perspective?
Okay, so so osteoporosis, when you say osteoporosis, it means weak bones. It means that the bones are brittle, that the bones are soft, the bones are, by nature, bones are strong, by nature, bones are, the bones are naturally a very strong part of the body, because it contains calcium. Bones contain calcium, which is strong. So, but when people start to get older, and they go into menopause, right? Unfortunately, their bones have tendency to get weak because, like I said, in women, the estrogen helps you build bone. the hormones, the female hormones, helps you to build strong bones. So when you start to get older, then your bones start to, the process it goes through, the body starts to resorb, the bones start to get weak. Osteoporosis, just know that, the simple terms, it's weak bones. The whole process is we're trying to strengthen our bones, either by supplements, which is you take vitamin D, you take calcium, you eat right, you eat food, vegetables, you exercise. And when you exercise, you have to do a little bit of weight bearing exercise, a little bit of weights as much as to make the bones strong. And then you stop smoking, then you limit alcohol, stuff like that. And then also, you prevent fall. Unfortunately, the older we get, we get unsteady, you walk, sometimes you feel like, oh my God, my ears are ringing, you get unsteady. So, you don't want to fall. So you have to, proof your house, make your house safe so that you minimize your risk of falling, because falls in old people is a problem. And then for men, like I said, if you have low testosterone, for whatever reason, you were told you are at risk for osteoporosis, weak bones, because testosterone helps to build bone, the male hormone. And of course, like I said before, people that take steroids for whatever reason, renal transplant patients take steroids, kidney, liver transplant, any kind of transplant, most of them take steroids. Steroids weaken the bones. So you have to screen for it. You have to tell your doctor, I've been taking steroids all my life. Can you please screen me for for osteoporosis, for weak bones? That is the synopsis of the.
So Dr. Chinyelu.
All right, we have somebody that raised her hand. Can we,
Elsie.
Elsie, can you give the doctor a quick one before we end the show?
Have we lost Elsie?
No, she's here.
No, she's right here.
She's frozen.
Elsie, okay, all right.
Doctor, while we're waiting for Elsie, is it correct to say that osteoporosis is the junior brother of Parkinson's disease?
No. Who said that?
Okay, Elsie is here now.
I didn't hear the question.
Parkinson's is okay. Do you want to go to Ifeoma's question first, or Elsie? Did you have any question for us? Elsie,
connection problem.
Okay. Ifeoma, can you ask that again?
I said, can we say that osteoporosis is the junior brother of Parkinson's disease?
No. I think Chinyelu.
No.
They're two different things.
Okay.
Okay, so I would like to read the question from Santos. His question is, are the bones weak due to minerals? Or I think he's trying to say due to lack of minerals. If yes, are there supplements that one can use to help boost the quality of the bone?
The bones are pretty much weak due to, like I said, the mechanism the body uses to form bones. They are weak because the body doesn't really have the mineral. I don't say minerals. The hormone that that puts together, like in women, is the estrogen that helps to, pull in all other elements that the body needs to form the bone. It's the lack of estrogen in women.
Oh, connection.
Okay. So I guess God gave us the bones to bear children. After that, He takes it away from us. So Ifeoma, do you wanna wait for her to come back, or?
Let's give it a few minutes and see. Okay. She's back now.
Yeah. So it's actually the hormonal, the lack of the hormone that helps to pull in all the elements that form the bone. I mean, I'm not gonna say it's the lack of mineral, but we know that when you take calcium and when you take vitamin D, it helps to fortify your bone. So hormone is the lack of estrogen in a woman at menopause is a big factor in development of the weak bones. So the whole idea of increasing your intake of calcium and vitamin D is to fortify your bones so that the resorption, because I mean, if I go into the physiology of how bone is formed, there are two mechanisms that form bone. One is trying to form the bone, the other one is trying to dissolve the bone. So when you get older, you find out sometimes the one that tries to dissolve the bone is working more than the one that is forming the bone. So that's why you're trying to fortify the bone that you already have so that it doesn't get resolved. So that is when the minerals come in. It's not that the minerals are not there, but you need to take more supplementation in order to fortify the bones that you already have. Okay?
All right. Thank you very much. Thank you, everyone, for being a part of this show. I am definitely sure you've picked up something and you've learned something. At least I now know to use my bones very well and very hard before I hit menopause.
Yes, sir.
So I don't start losing those bones. So I can do my fights before menopause. Thank you. Our next week topic will be, or is, growing up in Nigeria. That's a huge one. Nigeria is a country in West Africa, for those of you who don't know. So growing up there is an amazing event. We'll talk about that next week. Thank you so much. And do join us next week as we have another interesting time. Before you go.
And thank you so much, Dr. Chinyelu, for showing up today.
Always.
I used to bite my tongue and hold my breath, scared to rock the boat and make a mess. So I said quietly, I guess that I had a choice. I let you push me.
Please, I just to mention this. Can send me your email address. Then I can forward something.
I got the
help me down. Get ready, cause I've had enough. I see it all, I see it now. I got the eye of the
You know what I said?
Send it to me, then I'll share it.
All right.
So I'll speak to you after that.
We're rolling into our 50s, man.
Finish your voice.
50s loading. 50s loading with menopause, with osteoporosis, with prostates. We'll kill 50, we die with 50. Thank you, everybody. Love you guys.
This one today, I can't remember.
Get ready, cause I've had enough. I see it all. I got the eye of the
Join us now.
Maybe. They always get their wives.
Alright, guys. These